Hi everyone. Today we're going to look at various myths, misconceptions, and generally a fear that what generally patients have while going and meeting a dentist. The first general problem that most patients have when they come and meet us is that they tell doctor, we brush twice a day or sometimes even thrice a day. I brush for about 7 or 8 minutes and still I have all these gum problems and dental caries inside my oral cavity. What do I do? What did I do wrong? It always doesn't mean that if you brush harder, you are cleaning better. There is a correct way to brush the teeth. Actually, if you brush harder, you're going to cause damage to your teeth. Always meet your dentist and ask what type of brush and what type of paste is recommended for you. As a general consensus, we generally advise all patients to brush twice daily with a soft brush and a normal fluoridated paste. However, depending upon your oral hygiene recommendations and needs, your dentist might offer you a different type of toothbrush or a toothpaste. However, the consensus is that you should brush twice a day with a soft brush. And remember, brushing should always be done with vertical strokes rather than with horizontal stroke across the mouth. Okay, this would cause damage not only to the tooth structure, but it will also cause damage to the gums by causing thinning of the gums and weakening of the enamel. So you will have a lot more sensitivity if you tend to brush harder for a longer period of time. So generally brush 2 times a day with a soft brush using a fluoridated toothpaste and brush for a maximum of 2 to 3 minutes, which is very, very important. Like I said, the way that you are brushing is more important rather than the force that you are giving or the amount of time you are spending brushing. Vertical strokes 2 times a day is generally more than enough to improve and keep your oral hygiene. The other common complaint that most patients come and tell us is that our teeth is not very, very white. I want white teeth. I want to have teeth that most influencers have, which helps improve and boost my image. Remember, whiter teeth are not always healthier teeth. Now, as an Indian population, we generally have a mix of teeth which are off-white or slightly yellowish in color. So this is generally considered as a normal healthy color for the teeth. We're not really worried, as dentists, we're not really worried about the color of the teeth. Rather, you're worried if you're able to bite, chew, and able to give a good smile. So don't be too worried about the color unless it is damaged because of any medication that you have taken or because of any environmental factor like smoking or overconsumption of coffee or tea. So white is not healthier. It's okay if it can be yellowish or slightly off-white in color. It's totally fine because that is what suits our particular skin tone also. The other common problem that most parents tell us as dentists, especially when we try to save teeth of children, is that baby teeth are not important. Baby teeth are crucially important. One, it helps improve the patient's ability to bite and chew. Remember, these are small children. When they go to school, if they don't have teeth, their confidence is lost. Okay, so it helps improve their confidence. And it also paves way for the permanent teeth to erupt inside the oral cavity. So the importance of biting and chewing is very, very important. So it's not only important to eat healthy food, but remember the digestion starts inside the mouth. So when you bite and chew, only if a child has a good set of teeth, the child will be able to eat well and will be able to digest well and then go up and do its regular activities. So children's teeth are also very, very important. Like I've spoken about this in my previous episodes, children's teeth are about 20 in number and they generally followed by the time the child is 12 years of age. So till 12 years of age, it is important that we try to retain as much as milk teeth as possible. Like I said, these milk teeth or deciduous teeth pave way for the permanent teeth to then erupt inside the oral cavity. So it's important that the child brushes also twice a day. The child is still not able to understand how to brush. It's the duty of the parent to stay with the child, especially at night, and help the child to brush the teeth before going to bed. This is very, very important. So child's teeth is also important. Baby teeth are important. Though it does followed at a particular age, it is important that we treat them healthily and correctly. The other common problem that generally patients tell us, especially when we have to remove teeth, especially in the upper arch, in the maxilla, is that if I remove a tooth, will that cause other problems like blindness or something? Do not worry. blindness is not caused because of tooth extraction. There is a different nerve supply for the eye and a different nerve supply for the teeth itself. So if your dentist is qualified and you go to the right dentist, there is nothing to fear about a dental extraction. During an extraction, they generally give you a local anesthetic which works for about 2 to 3 hours, and in this particular time the doctor will gently peel open the gums and gently extract the particular tooth. Now if the tooth is very badly decayed or if it is a different angle, the doctor might then have to drill and remove the tooth structure. Again, this is all scientifically proved and it doesn't cause damage to any of the neighboring structures present inside the oral cavity. So there's nothing to worry about dental extraction. It doesn't affect any other organ or it doesn't cause blindness or any other problem to any part of the oral, other parts of the body. Oral health and general health. This is again something that most patients really don't take it very seriously. Oral health is definitely affected to the general health also. So remember, the digestion starts in the oral cavity and the mouth is the mirror of the body. So if you do not take care of your oral health, your general health also gets affected. So generally there are about 1 million different species of bacteria present inside the oral cavity at a given point of time. Remember that these bacteria can go via your bloodstream and can affect different organs. It can affect your heart, it can affect you if you are diabetic also, and can cause other problems. So the mouth is not separate of the human body. The mouth and the human body are together. So it's important to take care of your general health. It's also important to take care of your oral health. Just like you would go for an annual checkup for your routine complete body investigation, it's also important that you go to a dentist for your annual checkup where we could find out if there is something wrong inside your oral cavity. The other common problem that we generally face with younger patients is that doctor, you told us to brush twice a day. We can brush at any given particular point of time. Is it? That's not how it works. The scientific rationale is that you brush 2 times a day, once in the morning and once at night. So the reason we ask you to brush in the morning is because any type of bacteria that has been lodged inside your oral cavity all over the night can cause halitosis or bad breath, and this can be brushed and removed in the morning. That is the reason for brushing in the morning. Brushing at night is very, very important, especially for younger children and for people who tend to eat a lot of junk food especially. Okay. Why is brushing at night important? Generally before going to sleep, if we eat any type of sweet or eat a lot of junk food and immediately go to bed, you have all these carbohydrates that get accumulated and stuck on the tooth surface. So once it is stuck on the tooth surface, overnight our salivary flow tends to reduce. Once our saliva flow tends to reduce, you have bacteria that starts acting on the tooth surface, causing more amount of decay overnight. So it's also very important to brush at night. So brushing in the morning and brushing in the afternoon will not help. Brushing in the afternoon and brushing in the evening will not help. Brushing in the morning and brushing at night will only help reduce your chances of getting dental caries. So the time when you brush your teeth is also very, very important. Another cause of concern for most patients is especially during pregnancy. Doctor, we are pregnant right now. Is it okay? I have a dental problem. Can I postpone it for after pregnancy? So treating a patient who is pregnant or is planning to get pregnant is generally the job of a dentist. So most qualified dentists generally focus on improving the mother's health. So if you are planning to get pregnant, please visit your dentist for any fillings or a dental scaling that has to be done. It helps improve your health. Also, during the course of pregnancy, there could be small changes that happen inside the oral cavity. You can have more amount of bleeding. You can develop a small enlargement in the surface of your gums. This is again nothing to worry about. These are because of hormonal changes that happen during pregnancy, and generally they reduce postpartum. But it's important that you always have a conversation with your dentist for any problem that happens during the course of your pregnancy. Remember, a dentist is well qualified. We would modify the treatment as such. You can modify the treatment time. We can take safe x-rays also during pregnancy so that we're able to identify what the problem is. So you can visit your dentist during the course of a pregnancy to check if there is something wrong, especially inside the oral cavity, because it not only affects you, but it also affects the fetus inside you. So it's very, very important to create a rapport between you and your dentist, especially during pregnancy. Another common problem we generally face as dentists is that patients, when they have toothache, they generally keep clove or they apply any sort of home balms in this particular on the gums or on the tooth surfaces. So these generally give relief for a short period of time. However, they tend to cause more amount of damage. They tend to burn out the gums, which is basically the skin of around the tooth, and cause damage around that particular side. So if the tooth is damaged because of dental caries, we advise you do not take any sort of medication without the doctor's consent. Do not apply any sort of balms. Do not apply clove or clove oil into that particular side. Though there may be a temporary relief at that particular point of time, in the long run, it might cause more amount of damage than any good it does for you at this particular point of time. Rush to your dentist and find out what is actually wrong in this particular point of sight. Another common misconception generally happens is that dental x-rays are considered as very dangerous because there's a lot of radiation that comes because of dental x-rays. Dental x-rays right now are considered very, very safe. It can be done for children, it can be done for adults, it can be even done for pregnant women. So you can use a lead barrier or a lead apron to cover yourself and protect yourself from any sort of X-ray radiation that is there. Okay, so even if a dental visit, for example, a root canal procedure might require 2 or 3 different X-rays, you don't have to worry about it. The radiation exposure from a dental X-ray is very, very less, and it is very safe for all people of different types of age groups. Doctor, the last time I went to a dentist and I got the cleaning done, I feel that my teeth are shaking and there is a lot of gap between my teeth and the enamel has come off. So this is also a common problem that most patients say, that they are scared to go to a dentist and they feel that scaling or teeth cleaning can remove the enamel surface of the tooth and can cause shaking of the tooth. Now remember, this piezoelectronic device vibrates at 25,000 to 45,000 cycles per second and is designed to remove deposits on the surface of the tooth. You can even try it at your dentist clinic. You can try to run it on your finger. It will not cause any sort of damage. So a device that cannot damage your finger definitely cannot destroy the toughest part of the body, which is the human enamel. Okay. So these deposits are formed because of plaque and food accumulation on the tooth surface over a long period of time. So these end up being yellowish or yellowish black or yellowish green deposits on the tooth surface, generally in the lower front teeth on the inner surface. Okay, so this is nothing but calculus. So these hard deposits on the tooth surface are generally removed with the help of an ultrasonic scaler. So the feeling that you have that the teeth are mobile is generally a transient feeling where the damage is there for a shorter period of time. However, if you let this calculus and plaque deposits on the surface of the tooth, it tends to go to a more subgingival or a more deeper level and destroy the gums totally. At that time, as a dentist, we might not be able to do much and a tooth might have to be removed. So do not worry about ultrasonic scaling using an ultrasonic device. It does not remove enamel. It does not remove any sort of tooth structure. It only removes the deposits on the tooth. If you're worried about the gaps that are formed in between the teeth, don't worry. If the gaps are very, very minimum, the gum tissue will generally automatically form and it will come back to normal health over a period of time. So these are few misconceptions that we generally see when a patient walks up to us in a dental clinic. I'm sure you will have a lot more queries or doubts. You can feel free to contact me. But however, please do go and ask your dentist before you get worried or scared or anxious about any sort of dental procedures. Most dental procedures are safe and can be done in about 45 minutes to 1 hour without causing any damage. Take care of your oral health. Thank you.